Seconal sodium, also known as secobarbital, is a medication used to calm patients just before surgery. It belongs to a class of drugs called barbiturate hypnotics and works by affecting certain parts of the brain to induce calmness. It is important for older adults to discuss the risks and benefits of this medication with their doctor or pharmacist, as well as other effective and possibly safer treatments. The daily dosage and optimal timing for taking seconal sodium should be determined by a healthcare professional. Before taking seconal sodium, make sure to read the medication guide provided by your pharmacist. It's important to take this medication on an empty stomach as directed by your doctor before surgery. The dosage of seconal sodium will depend on your medical condition and how you respond to the treatment. It's crucial not to take more medication than prescribed, as doing so may increase side effects. If you suddenly stop using seconal sodium, you may experience withdrawal symptoms such as anxiety, vivid dreams, shaking hands/fingers, twitching, and trouble sleeping. In some cases, withdrawal from seconal sodium can be severe and even include hallucinations, seizures, and rarely, death. To help prevent withdrawal, your doctor may lower your dose slowly. It's important to note that the risk of withdrawal is higher if you have used seconal sodium for a long time or in high doses, so be sure to inform your doctor or pharmacist if you experience any withdrawal symptoms. While seconal sodium helps many people, it's important to be aware that it may sometimes cause addiction. The risk of addiction may be higher if you have a substance use disorder. To lower the risk of addiction, it's essential to take this medication exactly as prescribed. Be sure to consult your doctor or pharmacist for more details. If you experience sleepiness, trouble waking up, dizziness, headache, tiredness, loss of appetite, nausea, or vomiting while taking seconal sodium, it's important to let your doctor know. However, many people who use this medication do not experience serious side effects. Be sure to contact your doctor if you have any serious side effects, such as changes in mood, trouble speaking, double vision, or memory problems. It's also important to seek medical help right away if you experience slow or shallow breathing, fainting, or a slow heartbeat. While very rare, if you have a serious allergic reaction to seconal sodium, seek medical help immediately. Symptoms may include rash, swelling, severe dizziness, or trouble breathing. It's important to note that these are not the only possible side effects, so if you notice anything unusual, be sure to reach out to your healthcare provider. And remember, do not drink alcohol while using this medication, as it can increase the risk of certain side effects. Before taking seconal sodium, it's important to tell your doctor or pharmacist if you have any allergies, especially to other barbiturates, or if you have any hormone, liver, kidney, or lung problems. Also, let them know if you have a history of mental/mood disorders or substance use disorder, or a family history of a certain blood disorder. This medication can make you feel dizzy or drowsy, and using alcohol or marijuana can make this effect worse. It's important to avoid driving, using machinery, or doing anything that requires alertness until you know how this medication affects you. Older adults may be more sensitive to the effects of this drug, and it can sometimes cause excitement or confusion instead of drowsiness in older adults, increasing the risk of falling. If you are pregnant or planning to become pregnant, you should not use seconal sodium as it may harm an unborn baby. It's important to ask your doctor about reliable forms of non-hormonal birth control while using this medication. This medication can also pass into breast milk and have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. Drug interactions can affect how seconal sodium works in your body, potentially increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are several medications that may interact with seconal sodium, including darunavir and MAO inhibitors. Other medications can also affect the removal of seconal sodium from your body, which may impact how it works. This can include medications such as disulfiram, phenytoin, valproic acid, and St. John's wort, among others. It's also important to note that seconal sodium may decrease the effectiveness of hormonal birth control, such as pills, patches, or rings, potentially increasing the risk of pregnancy. Additionally, The risk of serious side effects may be increased if seconal sodium is taken with other products that may cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, or muscle relaxants. As always, it's essential to talk to your doctor or pharmacist about any potential interactions and to check the labels on all your medicines for ingredients that may cause drowsiness. If someone has taken too much seconal sodium and is experiencing serious symptoms like passing out or trouble breathing, it's important to seek medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe tiredness or dizziness, inability to wake up, and a very slow breathing rate. It's crucial to get help right away in these situations. It's important not to share seconal sodium with others as it is against the law. If you are using this medication for a long period of time, your doctor may require you to undergo lab tests to monitor your blood counts and liver/kidney function. Make sure to keep all medical appointments and consult your doctor for more information regarding this. Seconal sodium is a barbiturate that is used to treat insomnia. It may also be used as a pre-anesthetic to help relax you before surgery. It's important to store seconal sodium at room temperature, away from light and moisture. Avoid storing it in the bathroom. Keep all medications out of reach of children and pets. When you no longer need seconal sodium or it has expired, it's important to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.